All right, we want to welcome back internal medicine specialist Dr. Rupy. Thank you so much for being here.
Thanks for having me.
Let's jump right in. The World Health Organization declared the coronavirus a pandemic. What exactly does that mean, and how does that affect us?
So a pandemic means an infection has gone global and is happening more frequently than we were expecting. And it's usually something that we don't have immunity to. The last global pandemic was actually announced in 2009 with H1N1. And so this is concerning because we do see that coronavirus or COVID-19 has entered into Hawaii. And so we have to be cognizant and vigilant about this.
All right, speaking of it being here in Hawaii, let's talk about the topic of quarantine. If someone has to self-quarantine, how do we prepare for that?
So I think the most important thing right now is that we're protecting our elderly and that we are protecting our most at risk. And so when it comes to quarantine, there's a couple of essentials that we really need to have in place. Those tend to be a 30-day supply of medications. So if somebody's on medications, making sure that you have those available to you. Over-the-counter medications like cough and cold medications, something to relieve a fever or pain like Tylenol would be important to have on hand. You also want to have any supplies, syringes, things like that, as well as hygienic products. I see toilet paper flying off the shelves. I think it's important to keep perspective and make sure that we're not hoarding things. You need 14 to 30 days. Beyond that, as a community, we need to protect one another. We need to make sure that everybody has access to these things. Now, a couple of other essentials we should have, including food, water, electrolytes. We also want to make sure that we are discussing plans with our families, especially with our elderly and our folks at risk. We want to make sure we have phone numbers for our PCPs as well as for hospitals, just in case symptoms arise and we know who to talk to. Telehealth is really important at this point. In Hawaii, we prescribe. And that would be important to get online, make sure you have access to it so that you're avoiding going to the hospital or into offices unnecessarily. You also want to make sure that you're planning for quarantine with your family members. So in case school closes or if there's daycares that close, you want to make sure that you've got a plan in place. Now, as far as quarantining in your home, preparing a location for somebody who needs isolation. So making sure you have a room available. If they can have a bathroom, if possible, that would be ideal as well. And even something that sounds really simple, but having activities to avoid boredom. We really need to prepare ourselves, plan, but don't panic.
That's true, because would be a self-quarantine, so you would be at home, you would need things to do. Yes. All of that's so important because, you know, we talk about being prepared to stay at home for 14 days, but you laid out a lot of things that I don't think a lot of people are thinking about. So let's talk about social distancing. We've heard this word in the news headlines quite a few times lately. What is that and how does that help?
So again, I'm going to go back to protecting our elderly and our most at risk. Now, social distancing is basically helping to prevent the spread of this infection. So you want to make sure that these folks are staying home as much as possible. Now, if you've got folks that you're concerned about going and picking up their medications, helping them out with groceries, those would be some steps that you could take to help them out. Now, other things that we can do, I want to reiterate, the cases that we're seeing tend to be mild in folks that are younger. So about 80% of cases tend to be milder, whereas in the older population and those at risk tends to be much more severe, and they're at a higher risk of having complications. And so by even us folks who might not have some of these comorbid conditions or might not be elderly, we want to also be taking these precautions so that we're not spreading it to our most at risk. And so avoiding handshakes, you could do a shaka instead. Sometimes this leads to a little bit of social awkwardness, but you prefer that than spreading.
Hey, there's a good reason for it right
now. And then also just avoiding those who are sick. If you are sick, please stay at home. Wear a mask if you need to be in public, and really avoid large gatherings if you are at risk. You want to avoid non-essential travel as well, because you don't know who might be sick around you.
So, you know, if someone does think that they maybe have COVID-19, when should they go to the hospital, or when should they reach out to their doctor and get tested?
So the folks who are having symptoms, so we need to utilize our resources properly. We don't want to overburden our system. So if you are concerned, the first thing that you can do is talk to your PCP or utilize telehealth. This way, you're not going in unnecessarily. You're talking to somebody about your symptoms, and they can identify your risk factors. So I want to stress here that if you do have symptoms such as cough, fever or exposure to a COVID-19 patient, you are going to want to notify whoever you're going in to see, whether it's the hospital or your PCP. That's why it's important to have those phone numbers on hand before you head in so that they can take the appropriate precautions.
Really quickly, let's get to two viewer questions that were posted on the Facebook or KH102 Facebook page. Eric asks, what makes travel particularly hazardous? Is it simply because exposure to objects and surfaces that other people may have touched?
So the biggest concern or risk happens when you're in close proximity with somebody who is sick, who is not wearing a mask and might be coughing. So within about 6 feet is the concern, because the transmission, it seems to be very contagious. And so those folks really, I can't stress enough how if somebody is sick, they really need to be taking those precautions, wearing a mask. If they can't wear a mask, they don't have access, making sure they're coughing into the crook of their elbow to try to avoid that spread. Now, if somebody were to come in contact with somebody who is sick on a flight, that's obviously fairly risky. Now, making sure to sanitize the environment around themselves is also important. There is a list that we can link to. EPA.gov has a list, as well as the CDC, of disinfectants that help to kill the coronavirus.
Good travel tips. Joy, speaking of masks and traveling, wants to know, do you recommend wearing a mask on the airplane?
If you are sick, again, if you are sick, trying to avoid travel, number one, but if you are sick, you need to be wearing a mask to protect others.
All right, Dr. Ruby, thank you so much for joining us in studio. We will put all of this information on our website, kh12.com. Howard, I'll send it back to you.